My name's Simone and I'm a clinical nurse manager in services for people who have a learning disability. You might also have heard this referred to as SPLD. I want to talk to you today about the importance of the Learning Disability Annual Health Check and what will make it a good quality annual health check, all of the things that should be included in it to make it a worthwhile experience for the patient. Before we start to talk about annual health checks, I think it's really important that you understand what a learning disability is and also gain an understanding of what having a learning disability means to people and their carers. A learning disability affects the way a person learns new things throughout their life. A learning disability is different for everyone, and no two people are the same. Lots of people who have a learning disability can work, have relationships, live alone, and get some qualifications. Other people might need more support throughout their life. As you can see from the slide above, a learning disability is lifelong. It's enduring, having started in childhood, and it will never go away. It's important to distinguish this from a learning difficulty, which is more closely linked to education and learning. As a collective, we should always be looking at ways to support people with a learning disability and give them appropriate care which really meets their needs. We also want you to have a good understanding of how to make a referral for people with a learning disability to SPLD. A learning disability occurs when the brain is still developing, before, during, or soon after birth, and several things can cause a learning disability. We do not always know why a person has a learning disability. Sometimes it's because a person's brain development is affected, either before they're born, during their birth, or in early childhood. Before birth, things can happen to the central nervous system, which is the brain and spinal cord, that can cause a learning disability. A child can be born with a learning disability if the mother has an accident or illness while she's pregnant, or if the unborn baby develops certain genes. This can be caused by things such as the mother becoming ill in pregnancy, problems during the birth that stop enough oxygen getting to the brain, the unborn baby having genes passed on from its parents that make having a learning disability more likely, illness such as meningitis or injury in early childhood. There are some health conditions where you may be more likely to have a learning disability. For instance, an inherited condition such as Fragile X syndrome, abnormal chromosomes, which some of you may know as Down syndrome or Turner syndrome, exposure to environmental toxins or infections and illness during pregnancy, a very premature birth, complications during birth which result in a lack of oxygen to the baby's brain, an illness, for example meningitis or measles, or injury or trauma to the brain in early childhood. However, sometimes the cause of a learning disability remains unknown. It's important to remember that a learning disability is different for everyone. The degree of disability can vary greatly, being classified as mild, moderate, severe or profound. But in all cases, a learning disability is a lifelong condition and cannot be cured. People who have a mild learning disability may have an approximate IQ of between 50 and 69. As the slide says, they may be able to live independently or have minimal support. They may not even see themselves as having a learning disability, which might increase their level of vulnerability in certain situations. They may be able to communicate effectively, to use technology, including mobile phones and text messages. They may have had educational difficulties when at school and experienced delayed speech and language development, and in some cases they may have difficulty holding down employment. Generally, they may be able to manage their activities of daily living, which includes their personal care needs, with minimal support. Occasionally, they can have difficulties in expressing ideas and feelings in words. At times, There may be a reduced ability to abstract and generalise what they've learnt, with a reduced focus and attention span. And there may be some difficulties with reading, writing and comprehension, which may affect their self-esteem and confidence. People who have a mild learning disability may be more vulnerable to societal effects, including aspects which could include cuckooing or safeguarding issues. Safeguarding may include financial abuse or neglect. So this is something to be mindful of when you're supporting anyone with a learning disability. For those people with a moderate learning disability, their IQ may be approximately 35 to 49. People are likely to have marked developmental delays identified in childhood, possibly with accompanying impairments, which could include physical, hearing, or visual impairment, autistic spectrum disorder, emotional disturbance, or an impairment in their communication skills. People with a moderate learning disability may be able to live more independently, but will generally require planned daily support to do so. The need for varying degrees of care and support to live and work in the community. Characteristics of people who have a moderate learning disability may include the need for varying degrees of care and support to live and work in the community. They may have adequate communication skills, but may struggle to use a mobile phone. They're able to learn to develop some degree of independence in their self-care, but are more likely to need regular supervision and prompting. They may also need more substantial assistance with communication, managing risk, dealing with social and/or emotional issues, and possibly more physical help with their mobility, continence, and eating. They're also likely to need support with literacy, numeracy, and managing their finances. Those people who have a severe learning disability may have an IQ between 20 and 34. They are likely to have had significant delays in reaching their developmental milestones as a child and have significant speech and/or communication difficulties. They may also have accompanying impairments such as physical, hearing, or visual impairments, autistic spectrum condition, emotional disturbance, or epilepsy. People with severe learning disabilities are likely to have had a limited awareness and understanding of themselves, of the people around them, and of the world they live in. They may need significant continuous support with their day-to-day lives. They may be fully dependent on others to satisfy their basic care needs, such as feeding and toileting, mobility and communication. And they're unlikely to have learned self-care skills in these areas. Most people with severe learning disabilities require a high degree of support in managing risk and possibly their behaviours, and need continual supervision indoors and outdoors. The last category is those people with profound learning disabilities, and their IQ is likely to be under 20. People are likely to have other sensory or physical impairments and complex healthcare needs. This might include behaviours of concern or distress. They may be more reliant on facial expressions, vocal sounds, body language and behaviour to communicate. They may have a very small range of formal communication, such as verbal speech or using signs or symbols, including Makaton. They will rely on others to interpret their reactions to events and people and to express whether they are in pain, and they may have difficulties in understanding the verbal communication of others. Some people with profound and multiple learning disabilities are fully mobile, but many use a chair, have difficulty with movement, and are unable to control or vary their posture efficiently. They may need specialised equipment to aid their mobility and support their posture. And they may also be more technology dependent, meaning they need oxygen, tube feeding, or suction equipment to reduce potential health-related issues. So there may be people registered with your practice or PCN that you are unsure as to whether or not they have a learning disability. When there is a lack of formal diagnosis, you can use the Learning Disability Screening tool, which is available on our referral form, to help support accurate inclusion or signposting. You can also liaise with your local adult learning disability team or SPLD to determine if people are known to services. By doing this, you will improve your learning disability register and ensure greater accuracy. This will improve accurate learning disability registers and is a way to standardise inclusion in the absence of a formal diagnosis. There may be occasions when you feel that having a confirmed diagnosis will be of benefit to that person. You could consider referring to SPLD for a diagnostic assessment, but there would have to be a direct clinical need attached to the request for assessment. For example, not having a diagnosis is impacting upon that person's ability to engage with healthcare services. So now I want to move on to talk more about having an annual health check, which I'm sure some of you will know about the importance of this process. We know people who have learning disabilities have significantly poorer health outcomes than the general population. Historically, there have been lots of inquiries and reports into cases of people's health conditions going undetected until too late. In particular, 74 Lives and Counting reflects stories which show some particularly poor examples of practice, some of which took place fairly recently. Learning from the lives and deaths of people who have learning disabilities and autistic people, also known as LEADER, was set up to ensure multi-agency reviews of every death of a person with a learning disability and autism to explore gaps in provision and things that could have been done to prevent or reduce the risk of the person dying. In 2023, LEADER found that 42% of deaths of people with a learning disability were avoidable. People with a learning disability can sometimes find it hard to know that they are unwell or to tell someone about it. So a health check once a year gives people the time to talk about anything that's worrying them and also means that they can get used to going to visit the doctor. It's really important to remember that anyone over the age of 14 with a learning disability can have an annual health check. Children would usually see a different doctor until they are 14 years old. In order to be invited to attend an annual health check, the person needs to be on the learning disability register at their GP surgery. There are many ways you can achieve a positive annual health check, most of which are relatively simple and are listed on the screen. You can pause the video to have more time to read through. On the screen, you'll see further ways to achieve a successful annual health check. I'm sure you're all very used to using Ardens and System 1, and you will find some very helpful learning disability templates on there, which will help you achieve a more effective annual health check. The use of reasonable adjustments for people who have a learning disability and autism is very important. Very often, reasonable adjustments are simple things that will improve the patient experience when they're attending for their health check. They could include things like allocating more time for appointments or offering the first or last appointment of the day so that there's a less busy or noisy environment for the person to wait in. There is a legal requirement for NHS services to provide reasonable adjustments as part of the Equality Act 2010. It's worth considering if the annual health check is taking place in the best environment for that individual. Could it be done at home or in their day centre to avoid disruption to their normal routine? It's quite important to make sure that people with a learning disability or autism don't have to wait very long. On occasions, having a lengthy wait for their annual health check will cause people to leave the surgery, so it's really important, where possible, that people don't wait too long for their appointments. And if they do have to wait too long, then keep them or their carer updated. It may be better for them to wait in the car until you need to call them through for their appointment. You can also provide easy read information or supporting videos if you need the person to understand anything, as this is often more easily understood by people who have a learning disability and will also help to support those who are unable to read or for whom English is not their first language. Think about whether you need somebody to be present, a carer or a chaperone, and always consider consent and capacity. Make sure you explain information clearly and directly to the patient, but ensure that their carers also understand. If you know that somebody has specific communication needs, then understand what their favoured method of communication is. You may be able to supplement communication with the use of pictures, a Makaton, or even follow their communication passport if they have one. There are many ways in which you can support people who have a learning disability or autism to have a better experience in primary care. One of the most valuable things is to ensure that they are on the Learning Disability Register. If they're not on the LD register, then they won't get invited for an annual health check. Equally, it's also very important to remove someone from the Learning Disability Register if it's not appropriate for them to be on there. Some of the reasons might be that they've just been added because somebody thinks they have a learning disability when there is no formal diagnosis. We've already spoken about the fact that people with a learning disability often communicate in different ways, and we should never assume that they are able to communicate verbally. With this in mind, it's good to use easy read information or to understand their communication preferences so that we can be communicating with them in the most effective way for them to engage in their annual health check. It's very important not to make assumptions about people's quality of life. If they have a DNA CPR document in place, then review it. Be clear why this is on the patient's record and consider, is it appropriate? If anyone has any reasonable adjustments, then you should be able to capture these by using the templates on Ardens and System 1. Very often we find that when a person with a learning disability presents with a new symptom, that this is put down to the fact they have a learning disability. So, for example, if they become more challenging in behaviour, it's often said that this is part of the learning disability, without trying to find the actual cause. Diagnostic overshadowing is a major cause of why some conditions go untreated, so it really helps if you are aware of this and the impact it can have for people who have a learning disability. Effective communication is the key to many things in life. Communication for people who have a learning disability is vital to being able to get them and their carers on board with most health checks. You should always talk to the person directly, even if you're not sure how much they can understand. It can be very frustrating for people when you speak with a carer, even if you're not sure how much information they are able to understand. I'm sure if we were in that person's position, we wouldn't like to not be spoken to. People with learning disabilities are more prone to a wide range of additional physical and mental health problems than the general population. This means they will encounter more barriers. There's been lots of research investigating organisational barriers experienced by patients and carers from ethnic minorities. This identified that variability in the availability of interpreters and link workers during consultations created difficulties. Problems were reported due to interpreters lacking competence to translate complex medical information. Evidence suggested that where the organisation of services fails to take account of the needs of parents and their sons or daughters with learning disabilities, willingness to approach services may be affected. For example, parents who are embarrassed by the behaviour of their son or daughter in waiting areas may be reluctant to seek health advice. As you can see on the screen, there are a lot of reasons why people may not access healthcare, and it is for us to try and work together towards breaking these barriers down. To ensure gold standard annual health checks, we should aim to adopt a whole team approach to annual health checks. From receptionists to clinical staff, everyone should understand the importance and do their best to support annual health checks. It takes a whole team to make annual health checks a really positive experience for the patient and carer. The more positive the experience, the more likely they are to attend in the future. Some of the things you might want to consider in your PCN or GP practice are to assign a learning disability champion among the admin team who can oversee the recall process. Making a telephone call to the person or their carer and following up with an easy read invitation letter may see more effective engagement. Easy read invite letters are available and should be embedded as template documents within Ardens. Sending out an easy read pre-health check questionnaire will often help give the person time to think about what they might want to discuss when they attend for their annual health check. Often having a reminder phone call the day before the appointment is also helpful and will hopefully help avoid DNAs. Ask for the person to also bring their My Health and Me folder, as this too will give you helpful information for discussion during the annual health check. Ardens and System 1 will also give you the option to print off easy read information about bowel cancer, breast cancer and cervical screening. Practices should invite all patients on the Learning Disability Register aged 14 plus for a review of physical and mental health needs annually. There's no set way to manage the annual health checks, and some practices undertake these in different ways, with a nurse completing the physical health checks and a pharmacist or GP undertaking the medication reviews. The health check could be 20 minutes with a healthcare assistant or a nurse, followed by 20 minutes with a GP or pharmacist. Again, there is no set way for this, but a gold standard annual health check could be anything up to 60 minutes. Annual health checks have been known to be the first time that serious conditions have been identified. Some of these have included bone fractures, heart conditions, hernias, constipation. Constipation is still a widespread issue for this population group, and one which can lead to excess hospital admissions or even death. It's relatively treatable with good care support and should be something that's able to be managed effectively within primary care. Menopause is often overlooked, with memory changes being put down to early onset dementia and changes in behaviour being linked to agitation or aggression when they could in fact be due to hot flushes. Remember the earlier slide about diagnostic overshadowing. We have a duty to work together to ensure that these conditions are better treated for people who have a learning disability. For those people who are unable to engage in formal cancer screening programmes, they can still be supported to undertake self-checks or for their carers to undertake visual checks. The annual health check can be a good opportunity to explain how to undertake self-checks and visual checks. Year in and year out, there are some common themes which emerge from leader reviews and which could have potentially been prevented should an annual health check have happened. It's really important after the annual health check to follow up on some of the actions that have been discussed during the health check. A good quality annual health check should always lead to the development of a health action plan, which should be printed off and given to the person or their carer. The health action plan will detail referrals that need to be made to other healthcare professionals. It will also tell the person if they need to book in for further reviews. That could include for repeat bloods, a medication review, or ECGs. It's also helpful for you to consider whether the outcome of the annual health check or a copy of the health action plan should be shared with the allocated learning disability nurse, social worker, or any other relevant healthcare professional. On the screen, you can see information about local authority adult social care teams who may be able to support anybody that you have seen for an annual health check. It also has the contact details for SPLD and some of the teams within that service. If you need further information on how to complete a good quality gold standard annual health check, then there's some really helpful information that you can find on the internet, designed by ACE Anglia and Suffolk Ordinary Lives. Thank you very much for watching this video. I hope you found it useful, and if you need any information, please don't hesitate to contact Health Equality Service on 01234 310 589.